Hepatitis C is a viral infection that causes liver inflammation, sometimes leading to serious liver damage. The HCV or hepatitis C virus spreads through contaminated blood. Now, until recently, hepatitis treatment was quite complicated, requiring injections and drugs that many hepatitis C infected people could not take because of side effects and other health problems. But that has changed radically. Today, hepatitis C is a curable disease with tablets, oral medications taken every day from between 3 to 6 months. Still, about half of the people with hepatitis C don't even know that they have got it because they have no symptoms, and it may take 20 to 30 years before the symptoms appear. Now, the largest group at risk includes everyone born between 1945 and 1965, which is a population 5 times more likely to be infected than other populations. What are the symptoms of hepatitis C? Long-term infection is known as chronic hepatitis C. Chronic hepatitis C is a silent disease, silent for many years or decades, until the liver is so badly damaged that you develop signs and symptoms of liver disease. Now, what are the signs and symptoms? If the liver disease is advanced, you may have a lot of easy bleeding, easy bruising. You'll feel very tired. Your appetite won't be good. Your eyes may be yellow, what we refer to as jaundice, and your urine may be dark colored. You may have itchy skin. Your abdomen, your tummy may be bloated with fluid. You may have swollen legs if it's that advanced. You may have lost weight. You may be confused, drowsy. Your speech may be slurred if your liver is failing. You may have spider-like red things on the skin, spider nevi. Now, all hepatitis C starts with an acute phase. The problem is it's very difficult to diagnose acute hepatitis C. So most of the time, when we see them, they've already got chronic hepatitis C. We miss the acute ones quite often, and acute patients can present with jaundice, tiredness, etc. Now, acute hepatitis C infection doesn't always become chronic. Now, in studies of people diagnosed with acute hepatitis C, only about 15 to 25% of them clear the virus, which means about 75 to 80% go on to develop chronic hepatitis C. This is quite different from B, where most of them recover. Hepatitis C, most of them don't recover. All right? Now, the virus spreads when blood is contaminated with the virus, which enters the bloodstream of an uninfected person. So it's blood spread. Now, the problem with hepatitis C is there are many different types of this virus. There are many different genotypes, we call it, various varieties. And the commonest type in Malaysia is type 3, followed by type 1. Although chronic hepatitis C follows a similar course regardless of which genotype it is, your drug therapy may depend on the genotype of your hepatitis C virus. Your risk of hepatitis C infection is increased if you're a healthcare worker who has been exposed to infected blood, say with a needle stick injury, if an infected needle pierces your skin. If you have ever injected or inhaled illicit drugs, if you have HIV, if you receive an unclean tattoo, all right, unclean tattoo, unsterile tattoo, if you receive a blood transfusion, that's a very important mode of transmission, or blood concentrates before 1987, if you have been on hemodialysis for a long period of time, if you were born to somebody with hepatitis C, or if you are a prisoner, or if you're born between 1945 and 1965. What are the complications of hepatitis C infection? Hepatitis C infection that continues for many years can cause significant complications, such as cirrhosis or scarring of the liver, hardening of the liver. After decades, many years of hepatitis C infection, usually about 20 to 30 years, cirrhosis may occur. And scarring of the liver makes your liver function poorly. Now, the most feared complication of hepatitis C is cancer of the liver. And a number of people with hepatitis C may develop liver cancer or liver failure when advanced cirrhosis or hardening of the liver may force the liver to stop functioning. How do you prevent hepatitis C? Protect yourself from hepatitis C by taking the following precautions. don't use illicit drugs, especially if you inject them IV, right? Because you would be at very high risk of hepatitis C. Be very cautious about body piercing and tattooing. Make sure you go to a reputable shop that handles sterile equipment that is clean. Yeah, unsterile equipment may transmit hepatitis C. Practice safe sex. Unprotected sex with multiple partners increases your risk of transmission of both hepatitis C and hepatitis B. So sexual transmission is occurring with hepatitis C, but the risk is usually low. How do you diagnose hepatitis C? Screening for hepatitis C is recommended in all adults between 18 to 80, even those without symptoms, because many of the patients may not know that they have hepatitis C because they don't have any symptoms at all. But if you're at high risk of exposure to hepatitis C, for instance, if you have ever injected illicit drugs or even inhaled illicit drugs, if your liver function tests are abnormal, all right, your liver function blood tests are abnormal, you should screen yourself for hepatitis C. Babies born to mothers with hepatitis C should be screened. All healthcare workers who have been exposed to blood or accidental needle sticks should be screened. All patients with hemophilia should be screened. Every single dialysis patient should have his or her hepatitis C test done. Now, patients who have received blood transfusions or organ transplants before 1992, any sexual partners of patients with hepatitis C, patients with HIV infection, anyone born between 1945 to 65, or those who have been in prison, they should have a screening test for hepatitis C. Now, if you do have a hepatitis C positive test, then you need to do your liver function tests. We need to measure the viral load to see how much of virus you have. We need to know what type of hepatitis C you have. In other words, test for the genotype of the virus. Your doctor will do all that, right? Then we need to know whether you've got complications from hepatitis C. Is your liver hard? If your liver is suspected of cirrhosis or hardness or scarring of the liver, we may send you for not just an ultrasound scan, but a special ultrasound scan that tests the stiffness of the liver tissue. That scan is called a fibroscan, or what we refer to as elastography. It's a special scan that tells you whether your liver is hard. And if it's hard, then you have got a complication of hepatitis C. These tests are available in certain medical centers. But at the very least, you should have a liver ultrasound, at the very least. A liver biopsy taking tissue from the liver may be necessary in some instances, especially to distinguish hepatitis C from other liver diseases. All right? That is not usually done, but it may be necessary in certain cases. Now, blood test screening, of course, should be very important and will be done by your doctors to determine how badly your liver is involved and whether your liver is hard or not, whether there's fibrosis. Treatment in hepatitis C has undergone a dramatic change. This is one of the few curable viral illnesses, all right? So the goal of treatment is cure. No hepatitis C detected in your body at least 12 weeks after you complete treatment. Now that is the goal now. So there have been significant advances in the treatment of hepatitis C using what we call DAAs, or direct acting antivirals. All right, these drugs have transformed the treatment scenario. You can be cured of hepatitis C. All right, so that's very, very, very good news. And your treatment may take from 8 weeks to longer, 12 weeks or even longer. So it's not very long, but it's very effective treatment, which we will decide upon depending on what genotype you have, whether you have liver damage or hardening of the liver or other medical conditions. But the treatment is available in most hospitals. It is available today. All right. So discuss your treatment options with a specialist, a physician or a liver specialist. They will tell you what treatment is required for you in order to cure your hepatitis C. However, if you have a very bad liver damage, your liver is failing, then a liver transplant, changing the liver, removing your damaged liver, replacing it with a healthy liver, that may have to be done by a surgeon if your liver is very badly damaged. In other words, you have liver failure, all right? But a liver transplant alone may not cure hepatitis C because the infection may return to the transplanted liver, all right? So you may still need antiviral medications, but these new direct-acting antivirals, the DAAs, that are so effective at curing hepatitis C are also effective at curing hepatitis C transmitted or acquired after a transplant, right? So the future is very bright for hepatitis C. The treatments that are available now are very, very effective. However, there's no vaccine for hepatitis C, unlike hepatitis B. Those who have hepatitis C are usually recommended vaccines against hepatitis A and hepatitis B. They are separate viruses, but they can also cause liver damage. So you don't want to get A or B when you've already got C. So go get your vaccines for A and B when you have any form of chronic liver disease, all right? Your lifestyle changes, well, some may be in order. Alcohol and hepatitis C are a bad combination, so stop drinking alcohol because alcohol will speed up the progression of hepatitis C. You don't want alcohol. Be very careful about your medications. Your doctor will advise what medications to be careful about or sometimes to stop. Especially herbal medications and supplements may not be necessary in patients with hepatitis C. And at the time that you are taking your hepatitis C treatment, certain other medications may have to be stopped as well. Your doctor, your hepatologist or liver specialist will advise. Don't share razors, toothbrushes, needles with others if you are Hep C positive. Don't donate blood if you are either hepatitis C or B positive. And if you have a sexual partner, make sure you practice safe sex.